On 20 January 2022, India reported over 3 lakh cases, and there is a high probability that this number will rise in the coming days. And by the surge of the COVID cases, India has officially entered into the third wave of the COVID-19 pandemic. But India is not the only victim here, because the world also records the highest number of COVID-19 infections, breaking all-time records. Apart from that, there is also a risk of rising Omicron cases in India and the world. Although the country has partially vaccinated 65% and fully vaccinated 47% of the total population, a question arises: how severe will the third wave be? And will the Omicron variant be more dangerous and life-threatening than the Delta variant? Let's discuss these questions and try to arrive at a conclusion.
The third wave is on in India. Almost 60,000 new infections were reported in a day. New cases have doubled in 4 days. In 9 days, they've gone up by 6 times. Omicron is fueling the surge. Metro cities are the worst hit.
Prime Minister Modi chairs a crucial COVID meeting as India's Omicron tally crosses 300. Prime Minister reviews preparations. States impose restrictions.
कई गुना अधिक तेजी से ओमिक्रॉन वेरिएंट सामान्य जन को संक्रमित कर रहा है.
Now, before we begin, let me share some basic history and statistics related to the pandemic. The COVID-19 pandemic in India is a part of worldwide pandemic of coronavirus disease or COVID-19 caused by the virus SARS-CoV-2. As of 20th January 2022, that is when I am shooting this video, according to official figures, India has second highest number of confirmed cases in the world after the United States with 35 million reported cases, and third highest number of deaths after the United States and Brazil at 485,000. The first cases of COVID-19 in India were reported on 30th January 2022 in 3 towns of Kerala among 3 Indian medical students who had returned from Wuhan, which was the epicenter of the pandemic. Lockdowns were announced in Kerala on 23rd March and in the rest of the country on 25th March. This was the beginning of the first wave of the COVID-19 pandemic in India. Daily cases peaked in mid-September with over 90,000 cases reported per day and dropped to below 15,000 in January 2021. But the second wave beginning in March 2021 was much more devastating than the first, with shortages of vaccines, hospital beds, oxygen cylinders, and other medical supplies in parts of the country. This was caused by the infamous Delta variant of COVID-19. By late April, India led the world in new and active cases. On 30th April 2021, it became the first country to report over 4 lakh new cases in 24-hour period. But things started to improve gradually with time, and the recovery was much swift compared to the first wave, as the lockdowns were largely designed to limit social gatherings, and the negative impact on the economic activities was also restricted. During and after the second wave, the Indian government also took steps to prevent and restrict further devastation caused by the pandemic, such as increasing production of medical oxygen, increasing hospital beds, spreading more awareness, and administering vaccines. Further explaining vaccination statistics in brief, India began its vaccination program on 16 January 2021 with the AstraZeneca vaccine or the Covishield and the indigenous Covaxin. Later, Sputnik V and the Moderna vaccine were also approved for emergency use. On 21st October last year, India achieved a milestone by administering 1 billion doses. And as of January 2022, the country has administered over 1.5 billion vaccine doses. The Omicron variant is a variant of SARS-CoV-2 that was first reported to the World Health Organization from South Africa on 24 November 2021. And exactly 5 days after being reported, WHO designated it as a variant of concern and named it Omicron after the 15th letter of the Greek alphabet. Omicron was first detected on 22nd November 2021 in laboratories in Botswana and South Africa based on samples collected. And as of today, the variant has been confirmed in 135 countries. Talking about a variant in detail, Omicron has an unusually large number of mutations compared to previous variants, several of which are novel and involve changes to the spike protein, reducing the ability for COVID-19 vaccines to prevent the disease. But the vaccines continue to provide strong protection against severe disease and hospitalization. Now, just to mention, because I find it interesting, is that one hypothesis explained the novel mutations of SARS-CoV-2 was transmitted from humans to mice sometime between mid-2020 and late 2021 before infecting humans. But these findings are unconfirmed yet. Reports suggest that Omicron multiplies 70 times faster than the Delta variant in the lungs, but evidence suggests it is less severe than the previous strains, especially compared to the Delta variant. Omicron might be less able to penetrate deep into the lung tissue, but overall the extremely high rate of spread combined with its ability to evade body's immune system means the total number of patients requiring hospital care at any given time is still of great concern. I'll talk about this later. Third wave in India started in mid-December when the COVID cases suddenly started to rise. But now, before I explain the ongoing third wave in India, let me introduce you all to the term R0 or R0. R0 or R0 indicates the number of people an infected person can spread the disease to. Based on preliminary analysis done by computational modeling done by IIT Madras, the R0 value was close to 2.9 nationally at the last week of 2021, but the number was recorded at 4 a week after that. Explaining further, Dr. Jayant Jha, Assistant Professor, Department of Mathematics, IIT Madras, said the R0 depends on three things, which is number 1, the transmissibility probability, number 2, contact rate, and number 3, the expected time interval in which infection can happen. So this is the reason why we are seeing such high number of cases in India, and these number of cases are expected to peak between 1st and 15th February according to IIT Madras. Though the Omicron coronavirus variant has spread rapidly around the world since it was first detected in South Africa, findings from several new studies suggest it may not be as deadly as the Delta variant, which drove the catastrophic second wave in India. However, vaccine booster shots and wearing masks remain the key weapons in our arsenal against the new variant. Interestingly, 3 new studies in South Africa, Scotland and England have found that Omicron is causing milder infections than the previous variants and is less likely to cause any hospitalization. That's good news given that highly contagious nature of the variant is likely to lead to a surge in cases around the world. Until now, the severity of illness from Omicron was unclear, but these new studies indicate that some biological features specific to the Omicron variant make it less dangerous than the Delta variant. And coupled with immunity in the general population because of the previous infections and vaccination, experts believe fewer patients will require hospitalization in the next wave of cases. Though Omicron has been observed to evade antibodies from a previous infection, it may not be able to escape the powerful but slower immune responses that prevent serious disease. Sharing the statistics of the new studies, the South African study reported a 70% lower chance of hospitalization from Omicron compared with other variants, while the Scotland study found out a 2/3 reduction in hospitalization risk compared with Delta. The English study, however, only reported a 40 to 45% reduction in the risk of hospitalization, but it's still a positive percentage. The researchers also cautioned that the results of the studies were still preliminary, and the Omicron is still likely to cause a large number of hospitalizations, particularly among vulnerable groups and unvaccinated people, given how quickly it is spreading. Now let's broaden our focus out of India and concentrate on the world. The countries across the globe are witnessing a record surge in the new COVID-19 cases. You can see the graph that COVID-19 cases have broken all-time record, but at the same time, deaths are fewer due to vaccines and natural immunity got by people who recovered from COVID-19. As facts about the spread of Omicron variant came out, governments throughout the world banned travel from southern African nations. Along with South Africa, travel restrictions were imposed on Botswana, Namibia, Mozambique, Zimbabwe, and many nations from southern Africa, damaging the economies which are heavily reliant on tourism. Countries all over the world scrambled to impose travel bans and restrictions on southern African countries in order to stem the spread of Omicron. As a result, South Africa claimed it was being penalized rather than praised for finding the Omicron variant. The External Affairs Ministry of South Africa urged the world leaders not to implement such inconsiderable and insensitive decisions in response to the detection of the variant. If you ask my opinion on this, what South Africa and other southern African nations faced was unfair and unjustifiable, because South Africa's scientists and the government showed transparency at an hour of need, alerting the world of this potentially dangerous variant, but what they got in return was travel restrictions and a crippled economy. Some of you may counter me on this point by saying what other countries did was accurate to contain the Omicron variant. But how far have the travel restrictions been successful? Think of that and let me know in the comments. According to me, the country which should be punished here is China and its Chinese Communist Party. Because of the intransparency about the important details of COVID-19 disease, the world suffered losses. But ironically, China profited from them in this pandemic. Technically speaking, it will take us forever to eradicate COVID-19 from this planet. But at least we can put this disease in an endemic stage, because a disease that is endemic has a constant presence in the population but does not affect an alarmingly large number of people or disrupt society. Many believe since Omicron is highly transmissible but apparently less likely to cause any severe disease as some previous variants, it could mark a transition from this COVID-19 pandemic chapter to an endemic phase. This point was also asked to Dr. Anthony Fauci, the chief medical advisor to the President of the United States, and he said it's too early to predict whether Omicron's rapid spread will help push coronavirus from the pandemic phase to a more manageable endemic phase. The World Health Organization Director General said he was optimistic that the COVID-19 pandemic will end in 2022 only if inequity between the developed, the developing and the underdeveloped nations ends. In a statement on Friday, WHO's Director General said that as we enter the third year of the COVID-19 pandemic, he is confident that this will be the year we end it, but only if we do it together. He also added that while no country is out of the clutches of the pandemic, we have many new tools to prevent and treat COVID-19. And the longer inequity continues, the higher are the risks of this virus evolving in many ways we can't prevent or predict. And if we end inequity, we end the pandemic. Now I want to share a post of Veer Das, a man who went viral over the internet for allegedly defaming India in United States.
I come from an India where the AQI is 9,000, but we still sleep on the roof and look up at the stars. I come from an India where we worship women during the day and gang rape them at night. I come from an India.
Now I'm not passing any comment on what he did in the US, as it is highly controversial, but he shared a very interesting and an eye-opening post on Instagram. You can see the post on the screen. I request you to pause the screen and read it. Language is a little bit rude, but you get the point, right? The point which he focused here was to everyone, especially the healthy people, to wear masks and follow social distancing so that the unhealthy or the people who have low immunization in their bodies do not suffer. In a recent poll reported by Deccan Herald in a sample size of 2,000 participants across India, said that 3 out of every 4 Indians are still not taking the basic preventive steps against coronavirus despite repeated warnings and threats by the government, scientists and the doctors. I'm sharing this data as these points need to be highlighted, because even today careless attitude of people in wearing masks and following social distancing norms is leading to a surge in coronavirus cases. So in conclusion, I request everyone to follow COVID-19 protocols, wear masks and follow social distancing. So that's it for this video, and if you find this video interesting, then please like and subscribe. Thank you for watching.